President William Ruto has dismissed claims that the government intends to sell the health data of Kenyans under its new health agreement with the United States. Defending the 323.8 billion shilling deal, Ruto sought to assure Kenyans that the agreement complies with all local laws, including the data protection regulations, urging the public to ignore non-governmental organizations and agencies opposing the deals. David Muthoka reports.
The 5-year Kenya-United States Health Cooperation Framework has been at the center of controversy since it was signed last Thursday. Questions have been lingering over what the United States stands to gain from the agreement after it emerged that the Donald Trump administration will contribute approximately 208 billion shillings to the deal, with critics alleging that the William Ruto administration intends to trade the health data of Kenyans.
Specifically, fixed.
Seeking to quell the allegations, President William Ruto has maintained that Kenyans' health data is not part of the agreement with the United States, stressing that the deal is guided by security considerations and the interests of the Kenyan people.
Nobody and no government will take advantage of the people of Kenya so long as I am president. Because I am clear what we want, I am clear where we must go, and therefore there is no equivocation of whatever that the agreement we signed can undermine the interests of the people of Kenya.
The president further claimed that some of the opposition to the deal stems from organizations that previously benefited from acting as third parties in US-funded health programs. Ruto added that it was the US government and not the Kenyan government that decided to change the funding structure.
You know, I know there are entities that have been benefiting from these resources, you know, and as a result, they are sponsoring all manner of stories around. If they have a problem with the current structure, they should go and talk to the government of the United States.
President Ruto made the remarks while chairing the 12th National and County Governments Coordinating Summit at State House, Nairobi. Among the key resolutions was a commitment to improve the terms of service for staff working under the Universal Health Coverage Program, as well as community health providers across the country.
The Ministry of Health, Public Service Commission, the Council of Governors, and the National Treasury shall develop a framework for the transition of UHC staff to permanent and pensionable basis. Additionally, the CHPs shall be covered under the SHA insurance cover co-financed by the two levels of government on a 50-50 basis, amounting to Kenya shillings 330 per CHP for each level of government.
David Muthoka, NTV, Nairobi.